My name is Jason White. I work for the Mid-America Regional Council. It's a council of local governments around Kansas City. And one of my projects is working on the issue of adverse event reporting. And on the Missouri side of our Kansas City region, we have been participating with the Center for Patient Safety for the last 4 years with the intent of trying to create an adverse event reporting system for emergency medical services. Adverse events are those things that we wish hadn't happened after we've done them. Wrong drug. We've administered the wrong drug dosage. We put the intubation tube down the wrong hole. Things that in reality happen in our industry because we are human and we're working in an extraordinarily complicated work environment with very limited support and the difficulties coming with how much light and weather and all those factors that affect our environment. Adverse events happen, we're human, and how to encourage local agencies to acknowledge they're going to happen and have an open environment so the frontline field employees are comfortable in saying, hey, I think something went where it didn't need to go, and an adverse event has occurred, with the knowledge that the management structure recognizes our human frailties and is going to build on that instead of be punitive. The hospital environment is actually reasonably studied on this topic in that we estimate that there are 44,000 to 98,000 people a year who die due to adverse events in the hospital setting. CMS would say it's closer to 120,000 people a year, but the point is it's a phenomenal amount of people that are ill affected by adverse events in the healthcare system. There are efforts going on to gather data from hospitals, and when you gather data and you can study the data, you can seek solutions. In the EMS community, we're very, very much at the infancy of the issue. We haven't broken down those barriers within local agencies to acknowledge that errors occur, and we don't have reporting mechanisms so that data can be gathered in a protected environment for the purposes of study and not for the purposes of punishment. We're hoping to move this topic forward in the conversation within the Kansas community, and KEMSA has been wonderful in offering continued opportunities for this conversation to expand. But we want to keep the topic on your radar screen so that as the opportunity arrives to maybe open up an avenue for adverse event reporting for EMS professionals in Kansas, that we can have some participatory process to bring that to fruition. If you've got questions, comments, or you just want to throw a rock at the idea, please give me a call. Jason White. My cell phone is 816-215-8524.